Very good afternoon to everyone. My topic is Clinical Survey of Blind Schools and Awareness of Higher Education Opportunities in Blind Students. It's not
Not moving.
not moving. So India is home to 0.24 million blind children, and only 10% of these kids are enrolled in blind schools. The medium of education in blind schools is primarily Braille, along with hearing assistance, large print or computer equipments. Very few higher education opportunities exist for blind children post-school. So the purpose of this study was to know the causes of blindness, the medium of learning, and the knowledge of higher education opportunities in children attending blind schools in eastern Odisha. So this was a cross-sectional study. 140 students in the age group of 10 to 16 years participated in the study. Visual acuity, detailed ophthalmic evaluation and refraction was done. The medium of learning and the knowledge of higher education opportunities were asked. So out of the 140 students, 88.28% were blind and 15.72% were severely visually impaired. 65.7% were males and 34.3% were females. So coming to the anatomical causes of blindness, the most common cause of blindness in our study was whole globe abnormality with microphthalmos topping the list. The second most common cause was corneal causes with infections, vitamin A deficiency and trauma. 14% of these children had retinal dystrophies and were secondary to ROP, and 7% of these kids had cataract, glaucoma and optic nerve disorders. Refractive correction by manual retinoscopy was possible in 14.2% of the children, where we were able to correct their logMAR visual acuity from an average of 1.66 to 1.1, and the most common area where we were able to correct were microphthalmos without coloboma. The medium of learning was Braille in 60% of the kids, and in 40% it was hearing assisted. Now the reasons for not using Braille was a lack of Braille trained teachers as well as books. There was also a difficulty in fine motor skills where the children were not able to learn Braille, and if there was a late age at enrollment. Now the problems that these kids encountered was the inability to read and write independently. They always needed a translator, and there was a difficulty in giving exams without a scribe. Only 30% of the students knew about higher education opportunities after school. But because very few higher education opportunities actually offer education to the blind students, and less than 10% of these kids were pursuing higher education post class 10. Now coming to the discussion, nowadays in the causes of blindness, the whole globe abnormality causes have gone up as compared previously where the corneal causes were the major component. So this could be because of maternal vitamin A, folic acid deficiencies, pesticide, alcohol or medications exposure as well as genetic causes. Even retinal causes have gone up, that could be because of ROP and retinal dystrophies. The corneal causes have gone down. This could be because of improved vitamin A and MMR vaccination in kids. In our study, 35.7% of the causes of blindness was avoidable, and hence there is a need for robust vaccination, ROP screening, pre and postnatal care. So there is also a need to enroll blind kids in schools at an early age with the help of awareness programs. There should be a uniformity in teaching methods and a need for more Braille trained teachers as well as books, need for more higher education opportunities, and the teachers and counselors need to inform the students on existing opportunities. So coming to the conclusion, the most common cause of blindness in our study was whole globe disorders. Medium of learning was Braille in only 60% of the students, and 30% of students had knowledge of higher education opportunities after